So I guess we'll get started. Pleased to announce Dr. Antigone Argyriou, who's a double board certified interventional pain management physician who specializes in physical medicine and rehabilitation, as well as pain management. She practices at the Spine Medicine and Surgery Center of Long Island, where she is dedicated to helping individuals recover from acute and chronic musculoskeletal and nerve-related injuries through non-surgical treatments, including advanced image-guided injections and neuromodulation techniques. Dr. Argyriou blends clinical expertise with a modern approach to communication in her practice, leveraging digital tools and social media to help demystify complex medical topics, improve care delivery, and foster stronger connections between patients and providers. I'm very happy to welcome you to us tonight.
Thank you. Thank you so much for that kind introduction. Good afternoon, everyone. I want to thank you so much. I want to thank Ms. Nee's Women's section for the opportunity to speak with you today. And it's an honor to be here with an incredible community of women physicians and talk to you about how digital tools like social media can be incredibly useful for both physicians and patients. And this is a broad topic. I have a lot to say. So here we go. So this is an outline of my talk today. I'll start off with some facts and statistics. I'll discuss some examples of how social media can enhance education and improve healthcare delivery for physicians and patients. I will go into some examples from my own practice and how we use social media to help us grow our digital footprint and our practice. And then I'll briefly touch upon some risks and challenges associated with social media use. So digital tools like social media are rapidly transforming healthcare. They're really helping enhance patient education and engagement. What was once a social construct for staying connected is now so much more, and its purpose has expanded, particularly in medicine. So social media platforms offer opportunities to promote health, personalize information, build communities and support. And it's important to remember that while it's useful, it also presents challenges, including misinformation and some issues with privacy. There is access to medical information more than ever before on multiple social media platforms. And as physicians, we need to control the narrative when it comes to medical information. And so we owe it to the patients, we owe it to the public to screen and reject any unproven or flat out wrong medical information. And so social media is a great way to do this. So these are some statistics. 92% of online adults globally have at least one form of social media, and up to 80% say they are active users, which means they use this daily. And that's 5.24 billion users globally. That's almost 65% of the world's population that's connected to social media. Users spend, I think this is crazy, an average of 2 hours and 21 minutes daily on these platforms. So that's a lot of time. Users are engaging with an average of 6 to 7 different social media platforms every single month. And over 1/3 of all time spent online is spent on social media websites. And this statistic is from 2015, so I'm sure that's much higher now. And so really, social media is very powerful stuff. What we post online can reach a tremendous audience. And so social media can be a very powerful tool for branding, not just ourselves personally as individual physicians, but also our entire profession. This is another article stating here where most people get their news. It's now from social media. Most people get news from social media than any other form of media. And today, it has surpassed TV as the primary source of news for the first time ever. So 54% of Americans now get all their news from social media compared to 50% who get it from television. And so this is crazy. This has become the news source of information. And so it's very important that as physicians, we have involvement in social media and are familiar with what is being put out there. As of 2025, more than 60%, hold on, I just need to move my toolbar here, sorry. As of 2025, more than 60% of people use social media to search for health information or medical information. 80% of social media users are specifically looking for health information, but nearly 50% are searching about a specific doctor or a healthcare professional. And so your reputation, whatever you're putting out there in social media, is really important. You know, patients will find you or they will look for you. About 60% of patients report searching for their physician online. Google is still the most common tool used for that. And so this can go both ways. Either you're online and have a great reputation, you could be online and have a not so good reputation, or you could just not be online, period. And so you're really not getting that access to these patients. And so there's a separate survey that found 42% of adults and 54% of millennials either are or would like to be friends with or follow their healthcare provider on social media. And we're seeing this more and more, where we see patients really trying to connect with physicians and friend them on social media and get regularly connected with them. Here is a list of different social media platforms and then their estimated percent of users. So right now, Facebook's still the most popular, followed by YouTube, Instagram, and TikTok, which is becoming really rapidly more popular, particularly among younger people. And then you have Reddit and Twitter behind that. And so social media can really help everyone. I'm going to go into more detail now about how it can help patients and physicians. And so this can help the public, it can help patients, it can help us, it can provide information, provide answers to questions, facilitate discussions, collect data. And then not included in this list is marketing and advertising. So these are the 4 pillars of social media that I've outlined for physicians. That would be education, advocacy, networking, and practice building. So very useful in these 4 realms. I personally use social media quite frequently, particularly for education. Now, this is education not just to patients or for patients or the public, but for ourselves. There's a lot of content out there. As female physicians, I'm not sure if anyone here is familiar with Physician Moms Group or PMG. This is a Facebook group for female physicians. It has 85,000 members currently.
Wait a second. Wait a second. Wait a second.
Oh, is that for me? Wait a second. Okay, I'm going to keep going. So for Physician Moms Group, 85,000 members. You can post clinical questions. There's a lot of support there. And then my personal favorite as an interventional pain doctor, Women Physicians in Pain Management, 619 members as a new attending. This was really helpful for me, a tremendous tool as a new attending to just post questions and get up to 600 other female doctors sort of help out and give me some help. So I really found that peer support really important. And so we've talked about how social media can be used to educate and engage patients, but there are some doctors who have really been able to reach and extend to millions of people. So there are some, Instagram famous or TikTok famous physicians, and they really use social media to expand wellness information and evidence-based care, but to a massive scale. So here we have Dr. Pimple Popper. So this is Dr. Sandra Lee. She's a dermatologist. She posts famous videos of popping massive pimples. That's very satisfying for many people. So she has 4.7 million followers. There's Dr. Mike. He has 4.1 million followers. He's family medicine. You have Dr. Alex George. I believe he's a psychiatrist, a lot of mental health content. He has 1.9 million followers. And then there's Dr. Miami. He's a plastic surgeon in Miami. Very funny content if anyone's interested in looking him up. He's over in Miami, plastic surgery, also has 1.6 million followers. And so my personal favorite is Lady Spine Doc as an interventional pain doctor. Really, really love her content. I also like that she's a female surgeon. She's really breaking ground on social media, 2.5 million followers. She's a female neurosurgeon. She's a mom. She uses her platform to educate. She has a lot of educational content, things about spine, neurosurgery, and a lot of advocates. She advocates a lot on her platform as well. She's very authentic, relatable. She's very funny. And so she uses humor to help educate, and it's really helped her gain a lot of popularity. And I'm just going to pause here really quickly because what she's doing is so important. She posts a lot of videos about being a female, about being a mom, being a surgeon, and how all of that is possible. And that is super, super empowering. So that's a tremendous message. And to be able to use social media and do it in a funny way in a 30-second video and put it out there is extremely important and empowering. And I'm going to pause to tell you a true story, an unbelievable story. I work with a female spine surgeon as well. And she had a consult in the hospital. It was an urgent consult. 75-year-old female, spinal cord injury, needed urgent surgery. And so my spine surgeon said, "Okay, this is the plan. You have the spinal cord injury. We need to operate." And she says, "Oh, well, my sister is a physician. I'd feel really comfortable if you spoke to my sister before we proceeded." So she said, "Oh, absolutely no problem. I'll speak to her physician to physician." So calls her sister, who's also a physician, and they discuss the findings, what's happening, and the surgical plan. And this female physician turned around and said, "Well, I really appreciate you spending the time to speak with me, but I would really appreciate a male surgeon's opinion." Which she was stunned, right? As a female physician, saying I would prefer a male surgeon's perspective before we proceed. And so we still have a lot of work to do. And so I really love some of these videos that these female physicians are putting out there that are pretty empowering. I have some of them here for you, and I hope you can hear them. TikTok is my personal favorite because it's quick, funny videos, very easy to edit. So if anyone is interested, I think TikTok is pretty easy to sort of get started. They also have these trends. So you can take these trends and copy them, make them your own, and then repost it. And it can be pretty funny. So there's this one particular trend called "I'm a feminist, watch me cook." And I'm going to play some clips for you. Let me know if they don't play.
No sound.
No sound?
No.
All right. I'll just go over it. So this trend was, "I'm not a feminist, I can actually cook." So this is a woman who had said, "I'm not a feminist, so here I cook." And so what the doctors are saying, "I'm a feminist, watch me cook." And then they have videos of them in the OR and operating and seeing patients and so on and so forth. So I'll play the next video. I'm really sad that you can't hear it, but I'll play the next one. And then this last one is a screenshot. Dr. Grunch, the orthopedic, neurosurgery. The neurosurgeon. And if you open up one of her videos where she's talking about being a female surgeon and a mom and all those things, I just see these 10,000 comments, right? And then you have, "Do you realize the power you have, ma'am? You save lives." And then someone else says, "For some reason, I feel like I trust you with my life." And then the last one says, "Daily reminder, you are a role model and someone I wish was my mentor." So these are incredibly powerful. So to have women like this go on social media, reaching millions of people, she is really transforming everyone's view of what a surgeon would look like. And I think this is really important. Oh, sorry. Okay. Now, many physicians can also use their platforms to speak out on other important controversial public health issues like abortion or gun control. This is Dr. Esther Chu here on Twitter speaking out about gun control. There are doctors that speak out against prior authorization issues, or they talk about their other legislative and advocacy work. So this really helps reach a broader audience. People understand the struggles that we as physicians may face or roadblocks to healthcare. And so this is a great way to sort of reach a larger audience. So in addition to advocacy and sort of, education, you can also use this to promote your practice, right? So you can post patient results, testimonials, features that you've had in the media. A lot of surgeons post their pre and post surgical results so people can, see that. And so if the phone is the new computer, social media is the new website. I love that, right? So we're really able to engage with a broad range of patients who are looking for this content. I'm going to switch gears now and speak a little bit about the 4 pillars of social media for patients. Right? So this is education, support and community provider engagement and storytelling. So a lot of overlap with how social media is helpful for us, right? So they can learn about their conditions, their symptoms, and their diagnoses. Online platforms help patients connect with other people who have similar conditions or experiences. There are a lot of forums for them. Also, patients follow their physicians online. They follow clinics and hospitals to stay up to date or to communicate directly with their physicians. And then lastly, storytelling. So content creation has become really popular, particularly with younger people. Content creation is really important. It's part of their identity, as can be a disease. And so a lot of patients are using their experience with their disease to tell a story and increase awareness about certain conditions and treatments, and can really change the world in terms of how we see and share health information. So that's pretty much exactly what I just said. I'm going to kind of speed along because in the interest of time here. These are all different communities and resources, digital tools that patients can use to stay connected. This is a pretty cool one called Patients Like Me. You go in, you type in your condition, and it immediately connects you to a whole community of patients with a similar diagnosis and going through similar things as you are. And so social media has completely changed and has changed the doctor-patient relationship. And I found this article to be particularly interesting because what it's saying is here, by increasing their knowledge, patients come more prepared to their consultations. They communicate with their doctor better, know what questions to ask. It actually makes patients more inclined to communicate with their doctor. And there are certain conditions or conversations that, or stigmatized conditions, and these conversations in social media about these conditions help people open up more. So it encourages their willingness to seek medical attention for something they may not otherwise bring up or be embarrassed to. And then briefly here, patient influencers, right? The new influencers, the next frontier in direct-to-consumer pharmaceutical marketing. So the pharmaceutical companies are seeing this, and they're using this now as a new way of advertising their products, right? So if a patient feels better, they're more likely to say, I took this treatment, I took this medication, I feel much better. And so they're using influencers to sort of promote, pharmaceutical industry is using this to promote themselves as well. And so again, sort of overlap here. It can benefit the doctor and the patient, can benefit the public. A lot of overlap there. I'm going to talk about some potential challenges. So there's a lot of misinformation, a lot of disinformation online. Just like we have the right to post whatever we wish online, so do other people. And so that can be really dangerous when the information is wrong. Or there's also issues with privacy and security. So you have to be careful when you're posting. You have to protect patient data. You have to ensure the privacy of your online interactions, particularly with patients. And then professional boundaries, right? You have to maintain appropriate professional boundaries when you're using social media. And then some of these physicians who have 4 or 5 million followers or even more than that sometimes, some of their videos can be quite controversial, and so they can start controversy, or some people may feel they're being a little, unprofessional because they're being very silly in these videos. And so there is always that risk of controversy or something you posting backfiring. And then the digital divide. So access to technology and digital literacy can vary among patients, and so potentially this can exacerbate any inequalities and health inequalities. And I'm going to particularly talk about misinformation and disinformation because that's a big issue with social media. And so several articles here highlighting this. This is a big problem. I again have here, these are just groups that promote anti-vaccine. There's this professional anti-vaxxer has 8,000 followers. There are, somebody posted this, are you sure your last prescription didn't cause your ailment? And this was posted by James Moore, who's a self-proclaimed shaman, and he has 3.9K friends. And so this content is going out there. So it's important that we put our content out there. And so we have to be a voice. We have to have a voice and sort of be able to correct any misinformation that's going on. These are groups that are available on Facebook, anti-pharma. This last one I found really, really disturbing. Ex-mental patient unbound, anti-psychiatry, anti-pharma, anti-police crusader. Thankfully, there's only 9 members in that group right now. But these are all available to sort of spread misinformation that can be dangerous. Living vaccine-free, anti-vax moms, 3,000 members, 9,000 members. And so we have a lot of this floating around. And I'm going to briefly play again. I know I'm over time a little bit. These are videos posted by chiropractors or non-MDs. And you can stitch these videos. So I think it's interesting. I know you can't hear what they're saying. In this first video, it's a chiropractor giving advice on, that you can hear that one? Oh, you can actually hear this one. Okay. So it's a chiropractor giving advice on cholesterol and correcting, basically giving wrong advice. I'm going to forward this. So this is the cardiologist saying, nope, this is wrong. Maybe you were right 20 years ago, but even then you weren't right. And so he sort of explains why. And so I think this is important because you sort of give that other side. Somebody who wouldn't otherwise know can watch this video and say, oh, wow, I don't need a statin. Oh, no, this is fine. Or can get health advice about their heart from a chiropractor. And this next video, again, it's funny. I really hope you have the audio.
To show you guys.
It starts with audio, but then it goes off.
Is it really? Okay, so this is a chiropractor who says, I'm going to show you what massive amounts of inflammation look like on an x-ray, and then shows this x-ray. And there are sort of subtitles there. So I'm just going to, just his reaction. This is Dr. Justin.
This is an x-ray.
So he's saying the stomach is 30 times bigger than it should be. And he's saying the arrow is pointing to, so there's so much inflammation that his stomach is 30 times bigger than it should be.
Meaning it is filled with.
And he's saying the stomach is filled with air. So much inflammation that the stomach is filled with air.
That x-ray correctly.
So he goes on to make fun of him that he's looking at the x-ray backwards. Even the TV show got it right when you didn't. So it's sort of important. And then the inflammation that he's outlining is actually, he's saying this is poop. It's not inflammation. What you're seeing on the x-ray is poop. And this last one is probably the most dangerous. So this is someone sharing a protocol. It's an herbal protocol for somebody who has herpes.
Water trying to ban this.
So STDs, lemon balm, licorice root, tea tree, aloe vera. And he's saying, why would they want you to know this? So they is us. We're keeping this information from them, promoting this book. And so if you have an STD, you just look it up in this book and it tells you what herbs to take and you'll be cured. And so I really do applaud some of the physicians that take the time to make this content correct misinformation and post, because I think it's important. All right. And so again, as physicians, we have to be the gatekeepers of evidence-based medicine. We have to speak out against misinformation. It is everywhere out there. And so I'm going to briefly switch into my practice, how we use social media. I'm going to go really quickly because I know I'm going over time. This is my colleague, Dr. Daniel Choi. He's an orthopedic spine surgeon. He's the founder of our practice. He's a big believer in social media. He has been for years, and he's really transformed our practice with social media and videos and content that he puts out all the time. He currently has 23,000 followers on Instagram. And he really uses his platform to share day in the life of a surgeon, which is really popular, vlogs, patient case studies, volunteer work, community service events, his advocacy work. And then, of course, the TikTok trends and funny videos and things of that sort. And he's become tremendously popular because of all that content. So you see, patients really want to see that. They really want to see their doctor. And so what we've also put out are some newsletters. We're constantly posting myth or fact. We're breaking some, common misconceptions about back pain, helping patients stay informed. We talk about different fitness apps and what's safe for your spine or what's not. And so we're using this other than self-promotion and advertising, patient education, and things that patients can access. And so this has clearly helped a lot. We've seen a clear upward trend in patient acquisitions and referrals. We get a lot of online referrals directly from all the content that we post. And just this year in April, we had 8 new patients from these sources. That grew to 10 in May, 25% increase. And in June, that jumped to 20. And all that corresponds with increased content. So the more we're posting, the more patients are coming in. And so in 2 months, it's a 100% increase, steady growth from April to June. And the most popular is organic content. So what is that? Those are authentic, candid videos. They're unscripted, behind the scenes. Patients love that. These are the new reality shows that people like to binge, right? And the most popular, again, are the day in the life videos. Day in the life of the surgeon. They get millions of views. And so these are our practice's top 5 videos. And typically those are the ones collaborating with Dr. Choi's personal page where he posts a lot. And so when we collaborate, so when our practice site and his professional site sort of collaborate on Instagram, we achieve over 500% to 700% more reach than our median. And so that really helps with visibility. And so these are clear trends here with, again, the most popular being organic videos. So that patients really, really like this. And so it's incredibly rewarding. I'm almost done. It's incredibly rewarding to share this with this information. It can be really time consuming. And so, yes, posting, thinking of content, creating this, editing, it can take a lot of time. As a full-time working mom, this can be even more stressful for us female physicians. We're already stretched thin. And for those of us who do value privacy, posting consistently can also feel a little vulnerable. It's kind of like exposing yourself. And so it is a balancing act, but I think that we can amplify our voice, we can extend our reach, and ultimately we benefit not just the patients ourselves, but also the public. And so in conclusion, social media and other digital tools have quickly become a prime source of information and education. It can offer powerful opportunities to enhance healthcare delivery and empower patients and doctors. And it's crucial to address potential challenges and ensure responsible and ethical use of these social media platforms and technologies to really maximize benefit while minimizing harm. And so thank you so much.
Thank you. That was an excellent presentation.
Yeah, I'm sorry I went a little over time.
Well,
No, it's fantastic.
Thank you.
I think we could open it up to questions.
Sure.
Anyone have any questions?
On that wonderful presentation. I know it's always challenging when you have to share your personal views, and I always worry, is someone going to use it against me?
100%. And actually, Dr. Elizabeth Potter, I think is her name, she went on TikTok and recorded peer-to-peer conversation with United, recorded the entire conversation, spoke out against it. She worked for a hospital system and she's a cancer plastic surgeon, I think, breast surgeon. United pulled out of the hospital she was working for to punish her. And that's punishing patients. And so there's this big controversy. She started a GoFundMe because she's involved in this legal battle now. And, and all that because she was trying to expose how frustrating it was for her to be on a peer-to-peer for a necessary surgery for a patient having, breast reconstruction for cancer. So yeah, there's always that it's very challenging. It's very difficult.
That's crazy. Very hard.
Yeah, one other thing that worried me too, that one of my mentors had said is, they were like, oh, you liked something. And they said, do you realize that you liked something that when you look back on all of their posts, like maybe years ago, 20 or 30 years ago, they had a controversial statement. So I just thought to myself, oh my gosh, I liked this person, I liked something that was said in the moment, maybe it was a comment or something. So it's amazing that people really look in depth even in what you like. So you have to be very cognizant of that as well.
Absolutely.
I also have a question. That was great, Antigone. That was such a good presentation. I loved it. I just had a question also about what you had mentioned about being friends with your patients online. That can also be, you have to be very careful.
100%.
Online, we do have all our own personal social media, and then sometimes I'll post some like whatever pro-vaccine kind of stuff that I want to spread, and you start kind of getting into that, but then your patients you know, if they happen to follow you or they know you, then they kind of bring it up, and it can be like a slippery slope. You have to be very careful.
Absolutely. And so that's where, you know, the voice of reason in medicine sort of comes in, where, you know, you may personally insult somebody, right? But you're using science and you're a woman of science. And so you can say, okay, well, these are the reasons I believe in this. And so things like abortion, gun control, these are super controversial issues. Probably best to stay away from picking a side sometimes, you know. But at the same time, is it a good idea? Because, you know, maybe we need that other side. We have to fight for that other side. And who's going to be the one to do it? It's not easy.
Any other questions or comments?
All right. Well, thank you so much.
Well, thank you. This was a great.
Thank you so much. Really appreciate it.